World Health Organization has provided us with case definitions. Now, these case definitions are very important to us, healthcare providers and public health specialists who are monitoring this disease, because these case definitions tells us if we have on our hands a suspected or a suspected case of new coronavirus. Now, patients, the case definitions of a suspected or possible case are, and I'll explain. 1, patients with severe acute respiratory infections, meaning persons with experiencing fever, cough, and requiring admission to hospital, and any of the other 2 factors I'm going to mention. 1, a history of travel to or having lived in the city of Wuhan, Hubei province in China, within the 14-day window period, or a patient who is a healthcare worker who has been working in an environment where severe acute respiratory infections of unknown etiology are being cared for. Other suspected or possible cases are persons who fit the following criteria: patients with any acute respiratory illness and having at least one of the following. 1, close contact with a confirmed or probable case of the new virus within the 14-day window period, or a person who visited or worked in a live animal market in Wuhan City, China, within the 14-day window period, or an individual who have worked or attended a healthcare facility, a hospital or health center within the 14-day window period, where patients with this new virus have been reported. So these are the case definitions for suspected or possible cases. And these definitions are very important because you are aware that there is another CARICOM member state who would have had a scare last week Tuesday, and it was very reassuring to learn that the possible case did not meet any of these case definitions. The case definition of a probable case is a person for whom testing for the new virus is inconclusive, or for whom testing was positive on a pan-coronavirus assay. And of course, a confirmed case is an individual who received a laboratory confirmation of the new coronavirus infection, irrespective of clinical signs and symptoms. And so the healthcare professionals within our health facilities and those who are manning the health desk at the R.L. Llewellyn Bradshaw Airport, they are presently utilizing these case definitions as we increase surveillance at our borders. The World Health Organization conducted a risk assessment, and at January 27, 2020, the risk of the virus to the Chinese population was deemed very high. The risk of the virus in Asia and the West Pacific region was deemed high, and the risk of the virus to the rest of the world or globally was deemed high. Now, the International Health Regulations Emergency Committee of the World Health Organization convened its second meeting last Thursday, January 30th, and the Director General declared that this outbreak constitutes a public health emergency of international concern. In other words, it's expected that further international exportation of cases may appear in any country. And so each territory, each country is advised or is required to mount a coordinated international response is required. The World Health Organization has taken the lead in terms of providing us with strategic objectives for this coordinated response. And of importance is the the fact that we need to limit human-to-human transmission, including reducing secondary infections amongst close contacts and healthcare workers. So in essence, if we have a suspected case, it's very important for us within our territory to identify, isolate, and provide appropriate care for such individuals. Another strategic objective is to address crucial unknowns. For example, ascertaining the additional epidemiological data about this virus, the development of specific treatment or therapeutic options, and accelerating the development of diagnostics and vaccines. Communication is very important, and this is a very critical strategy. In other words, we need to keep our populations informed. So we need to communicate critical risk and event information to all communities and counter misinformation. And so when you look at the various articles, even the articles coming out of the World Health Organization, they claim that we are now experiencing an infodemic, whereby there is a whole lot of information circulating in conventional media and social media about this new coronavirus. And regrettably, some of this information is inaccurate. And it's our responsibility to provide up-to-date information to our population and even monitor the information that's circulating via social media and clarify this information and clear up all the misconceptions. We also need to minimize social and economic impact through multi-sectorial partnerships, and we need to identify and reduce transmission from the animal source. This really doesn't apply to us. This really speaks more particularly to the Chinese population. The World Health Organization provided us territories with a number of tools and resources. As I mentioned earlier, they've provided us with the case definitions in order for us to strengthen surveillance at our ports of entry. They've provided us with protocols for laboratory diagnosis of the cases. They've provided us with protocols for clinical management of the cases and a protocol, very importantly, for the infection prevention and control within the healthcare settings. Now, previously, the threat to the Caribbean region was deemed low. And this determination was made mainly because there are no direct flights between China and any of the CARICOM member states. However, persons come to the various Caribbean islands from China via other major ports in Europe and the United States of America. And basically, our understanding tells us that China is now screening all individuals exiting the Chinese border, and then the bigger European countries and the United States, they are doing entry screening. And so there is some amount of buffer or protection. And as Dr. Wilkinson mentioned, the Chinese authorities, they curtailed many of the Chinese New Year celebration activities. And so that was good. And if you've been following the news over this past weekend, you realize that an innumerable number of air carriers have now suspended flights to and from China. And so there will be a reduced number of persons reaching our shores from China. Now, what are the recommendations for the Caribbean member states? So in keeping with the World Health Organization and the Pan American Health Organization recommendations, the Caribbean Public Health Agency does not recommend at this time to conduct entrance screening, particularly temperature screening at our ports of entry. What this is really saying is that it's not very effective for us to have temperature screenings at our ports of entry, because as you've heard already, there are a number of persons who may be infected by the virus, and within the incubation period, they may not exhibit any of the symptoms. For example, they may not mount a temperature or a fever, and so they would pass the temperature test, and then they would still be infective. In other words, able to pass on the infection. And so passengers would already have been screened when exiting Wuhan City and China, and they would have already had entry screening in the US or European port through which they transited. So member states are recommended to capture information on travel history using the passenger arrival or immigration cards. For all new arrivals that have already traveled to China, especially to the Wuhan area, should be questioned for symptoms and advised to be vigilant for onset of those symptoms and to seek medical attention at a public health facility. Passengers should be advised to seek medical care as soon as symptoms arise. Now, each CARICOM member state is also advised to update its national public health emergency preparedness plans. Particularly, each member state would have a national pandemic viral flu action plan, and we are advised to make that current and update it to the 2020 version. It's interesting to note that the Caribbean Public Health Agency Medical Microbiology Lab in Trinidad is presently working with the Pan American Health Organization on the development of local laboratory capacity. All right, so based on the information that we have at present, there isn't a CARICOM member state that has testing capabilities as yet. All right, so CARFA is presently working on this, and I am told, based on information coming out up until yesterday, that within a few days this would be corrected. Interestingly, there are other CARICOM member states who have probable or suspected cases, and they too do not have any testing capabilities at this time. But all countries, all territories should be prepared for containment of this viral infection. And so the big question, what is St. Kitts and Nevis doing in terms of preparedness and response? Well, the Ministry of Health continues to inform and update the general public about this outbreak. So far, we have issued 3 media releases, and at present, you are attending our press conference, whereby we will be providing you all the up-to-date information regarding this outbreak. Continuing medical education sessions on the virus were delivered to doctors and nurses in the Federation of St. Kitts and Nevis, and this will be continuing as we learn more about the disease. This sensitization session took place in St. Kitts at the JNF General Hospital last Wednesday, and then earlier this morning I traveled over to Nevis and I conducted that sensitization session to the doctors and nurses there. The St. Kitts and Nevis National Aviation Pandemic Virus Preparedness Plan is being updated as we speak. The Ministry of Health continues to inform the public about good personal hygiene measures in order to prevent your contracting the flu or a viral infection of this nature. And Dr. Wilkinson already highlighted some of these measures, for example, frequent hand washing, avoiding close contact with ill persons, and recommending that persons who are ill with flu-like symptoms, they should really remain at home. The Ministry of Health, as I said before, we have strengthened surveillance at all our ports of entry. That's our seaport and our airport. We are particularly monitoring all international flights and flights from our regional hubs, including Antigua, St. Martin, and Puerto Rico. Now, you may say, what are we doing about the cruise ships? We are not particularly perturbed about our cruise ships because, as you are aware, that's very well covered. The cruise ships have a very robust system whereby they pick up ill persons on the cruise ships. They are properly isolated and quarantined and treated. Cruise ships, once they come into port, our environmental health team, they have to go on board and they check the Maritime Declaration of Health. And if there are 2% or more of persons who are ill on board the cruise ship, that cruise ship would not be given permission to have persons disembark. All right, and so we think that the cruise ships are fairly well covered, and so we are focusing particularly on incoming air travelers. All frontline port workers were formally sensitized to this new coronavirus and the new measures at the airport on January the 24th at the National Emergency Management Agency. And when I say frontline port workers, this included immigration officers, custom officers, airline agents, security personnel, and police, etc. And this session was well received. Of importance, all incoming travelers at our airports, they must now complete question 17 on the immigration customs form. In other words, our immigration officers will not be processing an incoming air traveler who would not have completed and declared the countries that they would have visited within the last 6 weeks. And we are asking for additional information, which includes the ports you would have transited through within the past 6 weeks. And if we pick up any individual coming from or traveling from China, such an individual will be directed to the health desk at the airport, and they would have to provide us additional information. And so they are screened with respect to their travel history. So we try and ascertain all the details regarding their travel history, city of origin, etc., and we determine the risk of their exposure to the new coronavirus. We also go a step further and inquire as to their health status, including their temperature, and we ascertain their contact information. These are some of the questions that our health personnel are asking during this process, this screening process at our airport. The health team within St. Kitts and Nevis stands ready to identify, isolate, and manage suspected cases of this new viral infection. I repeat, the health team in the Federation of St. Kitts and Nevis stands ready to identify, isolate, and manage suspected cases of this new viral infection. The National St. Kitts and Nevis International Health Regulations Committee within the Federal Office of our Ministry of Health continues to monitor this outbreak closely, hour by hour, minute by minute. The health desk at the R.L. Bratcher International Airport is covered by nurses and our environmental health officers. And St. Kitts and Nevis issued a travel advisory, which was announced on Saturday, February the 1st. The travel advisory speaks to citizens and residents being advised to restrict travel to China until the World Health Organization gives the all clear in relation to the novel coronavirus. Persons who have trips planned to China, we are asking you to postpone same. Persons traveling from China or who have traveled to another country from China en route to the Federation within the last 14-day window period, we are asking you to remain where you are and not to travel to the Federation. Persons who travel to St. Kitts and Nevis from China at this time shall be subjected to screening at our ports of entry and may, if necessary, have their movements restricted. All right, so this is a summary of the proactive interventions that we have made nationally so far. And I thank you.